an empowerment workshop, fall prevention. We're going to go over some things about preventing falls inside the home and other places, and techniques to get down on the floor and techniques to get back up. We're not going to have anybody fall accidentally. All right? Can we do that first?
It doesn't matter.
Okay, can I do that first?
Whatever you want to do.
So has anyone in here ever fallen? I think everybody, right? At least at some point in our lives. As we age, that becomes a little more scary for sure. So I'm going to go over myths versus realities. This is in your blue folder if you want to read along. I'm not going to read all of them, but I'm going to hit the ones that I think that are more important. Seniors should never get on the floor because it's too dangerous. With proper technique and confidence, getting on and off the floor can be safe and beneficial for maintaining mobility. If you always do it, you'll always be able to do it for the most part. When you stop doing it, that's when you can't think back to the last time you got down on the floor. So if we learn how to and we have the strength how to and we continue to practice that, then you never have a question of if you can get back up because you just did it yesterday or the day before. Being on the floor is only for young people and children. Seniors can also benefit from floor activities such as stretching and playing with grandchildren, which promote flexibility and engagement. Myth: once you're on the floor, you won't be able to get up without assistance. Many seniors can learn techniques to safely get up off the floor independently. And I would add to that, strength. I'm always going to push the gym, of course, because that's my realm, but there are techniques and methods to gain the strength to get up off the floor, and then utilizing the techniques, you'll be able to do that. Those are things that are not outside of the realm of possibility. Myth: falling is inevitable, so it's best to avoid the floor altogether. You might be like, jokes, right? Okay. Practicing safe ways to get up and down from the floor can reduce fear, improve confidence, and decrease the likelihood of falling. There was one in here that I really liked. Let me switch the page. I'm going to go over here. Getting on the floor is too embarrassing for seniors in public or group settings. We're going to find out in just a few minutes. Participants in group activities that involve floor work can foster a sense of community and mutual support, because it's a place we may all find ourselves. Let's see, I got one more I wanted to read. You should always call for help if you end up on the floor. While safety is the key, knowing how to get up independently can be empowering and can reduce the need for assistance. And that's really the gist of what we're going to get to today. I'll let John take over.
I'm going to go through these fairly quickly, but any kind of impaired musculoskeletal dysfunction, and that's a huge garbage bag term, but there's so many things that includes. I'm not going to try to, go through them all, but if you have some kind of severe kyphosis or severe scoliosis or anything that affects your muscles and your skeletal system can make you at high risk to fall. Osteoporosis obviously can make you a high risk to fall. Cardiac arrhythmia can make you fall, and that is a very common diagnosis as we get older for all of us. Atrial fibrillation being the one that is probably most people are familiar with. Your heart starts beating irregularly, and that can put you at very high risk for falling. And going along with that, blood pressure fluctuation. So we kind of call that orthostatic hypotension, which is a fancy schmancy way of saying your blood pressure drops. Now, when somebody comes in from the hospital, this is one of the things I'm checking every single time. Because if you've been lying in bed for a long time, you've been sick, and then you get up we've all done that, gotten up real fast, whoa, okay? That happens all the time with a fall. So if you're lying in bed, when you sit up, just sit there for 5 or 10 seconds. When you stand up, don't just stand up and go. Just, especially if you know you're having these symptoms, just stand there for a few seconds before you go. Because those few seconds are much shorter than the time that you will spend with us down in therapy with a broken hip or a scalp laceration or something like that. And there's some other things that can cause that we'll go into also. Osteoarthritis. I've heard that there's a few people here who have arthritis. So it can make you, I'm gonna fall down here on these steps here. And then somebody's gonna have to get me up. I mean, there we go, all right. Hip weakness and imbalances. And this goes back to what she was talking about, strengthening. Your hip musculature is very important with your walking. Specifically, a muscle right here called your hip abductor. And this is your primary gait stabilizer. It is very, very important, but it's not really one that we necessarily hit a whole lot, because the way we strengthen that is like this, okay? But what will happen is if this is weak, and you've probably seen people walk this way, their hip drops. And that's very common after hip replacement. That for some reason, they never get that strength back. And then it just throws their gait off, and they can fall very, very easily. This is going to be obvious, but I have to mention it. Any kind of neurological disorder, CVA, stroke, Parkinson's, multiple sclerosis, any of those things that, brain injury, anything developing, interacting with your, or impeding your neurological system is going to affect your walking and make it high risk for fall. But it can also affect your balance and your proprioception in space, where you are in space, especially with a stroke. You'll see that, where literally they will not be able to tell where your foot is in space. So it's like they're trying to find it, okay? You also see that with hands and other stuff, but that can really, really affect you. And then there are certain techniques we use to fix that, but moving on. This one's going to be really obvious to all of you. Vision loss, hearing loss. That's one of the major components of balance also. You know, when you can't see, you're at high risk to fall. This is another big one. Side effects of medication. Talk to your doctor about that. I'm not here to tell you what you're on is one of those that can cause those effects. Sometimes it's a combination of those medications that can cause a problem. And one of your best resources of that, if you're not sure about all that with your medication, go talk to your pharmacist. Those guys know more about the different drugs, the different interactions than probably your doctors do. They are a great resource, and they are always happy to talk to you. Okay, personal risk factors. And this is one that drives me crazy, and y'all aren't gonna like me for saying it. Inappropriate footwear. I hate flip-flops. I know that makes some of you unhappy. Not a huge fan of sandals. I was waiting for a boo, but seriously, good footwear is really, and also, ladies, there's a number of reasons I'm going to say this, and now I will get booed. High heels. Yeah, just. But you want good support. Now you also want them, I realize you want them easy to get on and off, but I do not like anything without something on the back, because you're just so much more likely to trip, or that shoe comes off. And I'm speaking from experience. I've seen it time after time. proper footwear, and it's such a simple thing, and if it reduces your risk of falls by 5%, 10%, whatever, hey. It's just such an easy fix. The next one, and this goes back to what I was talking about with the dropping of the blood pressure. We as a society, but especially as we get older, we don't drink enough water. You need to be hydrated. And I get it. I get it. You know, I drink, you know, how many are we supposed to have? How many? A lot. I don't know. I drink the required amount supposedly, and I'm going to the bathroom all freaking day long. I get it. It's like my body's on it at night. That's like I have a two-hour time schedule to get up and time to go to the bathroom. You know, it's a pain. I hate it too. But hydration is important, because what happens when you get dehydrated? Remember we talked about how that blood pressure will bottom out. Get dehydrated, that blood pressure will bottom out, and that can lead to a fall. So please hydrate yourself. There's a lot of other reasons to hydrate yourself, but that's a very important one. Now this really does not apply to anyone here at the ARC ever, but excessive drinking of alcohol. And I will just leave that alone and move on. Environmental risk factors, and these are mostly things I'm going to go over that we can fix pretty easy. Slippery or wet surfaces, obviously bathroom, shower, commode. I mean, that's like the number one place I worry about falls. Bathroom, showers. So if you have some tile floors, you know, hey, that area is slippery, let's do something about it, and we'll get into that a little bit later. Another one, poor lighting. Lighting, we're going to go over some of these things to do. Lighting. You need to be able to see, especially if you have decreased vision. You know. Now, again, some of these I know probably don't apply to anybody here, but I've been in a few homes here. If you've got boxes and clutter everywhere, I mean, again, I'm preaching to the choir here. You know, it doesn't apply to any of you here. But if you've got it's a minefield to get through that puts you at high risk for a fall. I like big, wide hallways, open areas. Now this is another one that's going to get me booed, and I love them. Throw rugs. I am not the fashion police. I'm not trying to tell you how to decorate your apartment or whatever, but I'm telling you, it's just so easy to just catch your foot on those throw rugs, or even catch your walker, or the wheels, or even the skis, and down you go. So there are some sticky things that you can put down to decrease that risk. So if you can do that, again, an easy fix. It decreases your fall risk. Anything you can do to decrease your fall risk. And these are the things that you can do beforehand. But anyway, throw rugs. Pets. I love animals, love dogs, love cats, love all of them. However, I cannot tell you how many people I have treated with broken hips because of their pet, because either their cat or their dog got underneath their feet, down they went. You have to be aware of that. And I cannot tell you how many people I have treated that were walking the dog. Dog sees squirrel. Dog must attack squirrel. Or another dog. Another dog. They're on that leash. They got the leash around. Down they go. So you just be aware. I think some of those leashes now have like breakaways. If they start pulling on them, they'll break away. Because I'd rather have somebody go catch your pet than have to be picking you up off the cement outside with a broken hip. And then again, you get to see me for 4 to 6 weeks. Okay, so moving on. Let's talk about some of the different things that we can do to change the environment, the things that we've talked about. The bathroom. Slip-resistant rugs or rubber mats right in front of the shower or bathtub that you're getting out of. Okay? I don't have a specific one in mind, but putting a towel there is probably not the best idea, because towels move when you step out sometimes. You want something that is going to stick to the floor, okay? Rubber, non-place skidded mats inside the tub or shower. And there's a lot of them now. They have the holes so the water will drain through them. But because you're dealing with an area with water and soap, that's just a prime recipe for a fall. It is the #1 place for falling. So anything that you can do to decrease that risk, like I said. This next one, whenever we have somebody in healthcare, we usually like to go do a home assessment of the apartment. And most of these apartments are already laid out really, really good for stuff. But sometimes we go in and just depending on that person's specific diagnosis or whatever, grab bars. I love grab bars. Grab bars are your friend. Inside the shower, outside the shower. And some people don't have them outside the shower, so when they go to get, and especially if they're in a tub or if they have to step over. So here we are. Let's just imagine there's a little bitty ledge getting out of the shower, and it's all wet and soapy. And for this brief instant in time, you're standing on one leg. That's dangerous. I mean, that's difficult. So if you have a bar that you can reach out when you're getting out, it's just so getting in or getting out. You have something to hang on outside. Okay. And if you have any questions about that, you can see me, maintenance, or Debbie, or anybody. If you think you may need an extra one, I'd 10 times rather add an extra bar than again be dealing with a fall. Okay, but most of these are really well laid out, but there are times that you need one. The commode. A lot of these, one of the things that we put in a lot of here, especially in the older ones, is the elevated commode seats with the bars. Because it is so much easier to get up when you add the assistance of your arms to push up, as opposed to just doing it with your legs. And your walker is not meant to be pulled up on. It will fall. The plastic thing that holds the commode will not help you up. And the other #1 thing is the towel holder will come out of the wall if you pull on it. If you use it to brace yourself, or if you start to fall and you try to grab it. Okay. Now, one thing that you can push on if your commode is close enough is your sink top, because that's stable. You can use that if it's close enough in some of the cottages. A night light in the bathroom. We talked about the poor vision. You go in the middle of the night, you're a little groggy. Maybe you didn't drink enough water the night before. Whatever. And they have these now. I mean, you can plug them in. They're motion detected, so the light doesn't have to stay on all night and bother you. But if it senses motion, that light comes on. An easy fix that will decrease your risk of falling. Excuse me. Moving on, let's talk about the kitchen. Store food and dishes and equipment within easy reach. Do not stand on chairs or boxes to reach upper cabinets. And yeah, I've trained a lot of people that did do exactly that. You know, what I tell people to do is to centralize everything. The stuff that you use the most, you have it within reach. The things that you don't use very much, you put them way up top or way on bottom. Same thing in the refrigerator. Don't put the things that you use where you have to bend down a whole lot. Centralize. Easy fix, okay? Again, but a lot of people like to have throw rugs in their kitchens. Get rid of them. I'm gonna try to go through this a little faster because I know I'm taking a little too long. Bedroom again, lamp, telephone, flashlight. Keep the light near your bed so that when you get up to go to the bathroom at night, again, the motion detector lights. Again, keep clutter off the floor. Arrange the clothes in your closet, again, centralize so that you don't have to be reaching up for something you're using all the time. Centralize the things that you wear the most, keep them where you can get them on easy. Keep the area around where you get off the bed nice and clear. Some of these satiny sheets people use, I cannot tell you how many have. I didn't fall, I slid out of bed. Okay. You did not, that's not a fall. Outside, keep a clear pathway in your driveway to your house. Wide pathways. You don't, hey, I love plants too, all that, but just keep a nice wide area where there's nothing you can trip over. And then, of course, you got to be aware of the curbs and all that. Again, I would put some sort of motion light detector so when you pull up, that light goes on so that it's nice and lit up when you're going inside and or even walking out at night to the car. We talked about footwear already. Let's see, we talked about the areas, motion activated lights, clutter. One other thing I see a lot is, it's funny, people get attached to their sofas and their chairs. If you have an older chair that has sank down and you're struggling to get out of it, maybe time for a new one. Higher chairs are easier to get out of than lower chairs. I know I'm being master of the obvious here, but if you're struggling to get it from a lower chair, you're at higher risk to fall getting out of that chair. And I know I'm up here saying all this stuff is master of the obvious, but I want to point it out because sometimes we just get so used to everything, we don't think about it. And then, of course, we talked about pets. Now, a couple of other things that we're going to get into with the falling, specifically on how to fall. I am a big fan of the medical pendants, but you know what's funny about those things? If you don't wear them, they don't work that well. So I am a big fan of those. And they've got all sorts of different ones now. They got the watches that if you go from here to here, it alerts somebody. There's so many things on the market, probably stuff that I don't even know about, that alerts people. Actually IT probably has a lot of that stuff that they know, even more. Cell phones are not that effective because you fall over there or in the bathroom and your cell phone's over there, that does you no good. One of the other things that I tell people to do, or family members to do, and it was actually a resident that told me to do this, and I just pass it on. You can buy those little Alexa dots or the Google things. I mean, you can buy the small ones, dirt cheap. IT can come in and hook it up, and you can put those strategically in areas where you are at high risk to fall, like the bathroom, bedroom. You could have 2 or 3 of them around, how many ever you want, knock yourself out. But so that if you do fall and you can't get, Alexa, call the front desk. Alexa, call my daughter. Alexa, call 911. Again, I think they're what, $20 maybe, or something like that? Pretty cheap insurance. And you don't even have to wear the Alexa around all the time. A couple things, and then we're gonna go over falling, and when you fall. Most people, when you fall, and it's very, very instinctive, it's reflexive, when you fall, what do? We call that a foosh injury, falling on outstretched hand, which usually means you end up with a broken wrist, among other things. When you fall, and I'm gonna read this verbatim so I make sure I say that right, do not extend on your arms to break the fall. Instead, raise your arms to protect your head. So instead of doing this, it's better to do this. Because your head is your most valuable commodity. I like mine. I'm fairly, well, it didn't look that good, but I'm fairly attached to it. Or it's attached to me. But anyway, so, and then the other thing is, try to fall on your side or your buttocks. That's where most of us have our most padding. You know, so if you fall, you'll kind of do this and try to roll and land on your side and your buttocks. Now I realize that's easier said than done in the midst of falling. Oh, well, see, what did he say to do? Yeah, I get it, but, and it may sound silly, but if you think, okay, just every now and then, okay, if I'm gonna fall, I want to remind me, how am I going to fall? And then analyze your cottage, your apartments on where might I fall? What do I have on the floor that I might not see or trip over? Again, the best fall is the one that we can prevent. So with that being said, you want to skip this? On the home safety check, if you look in your books here, there's a home safety checklist.
So we're gonna do the interactive part here, John. All right, you start by preparing your environment. This is if you're going to intentionally get on the floor with the premise of getting back up again. So practicing, getting down and getting back up. Preparing the environment so that you have a stable support. In this situation, we're gonna use this chair. We have the luxury of some nice padded equipment here. If you have knee problems, knee pain, it can hurt just to roll onto the knee, so we have some support there. John's gonna come around to the front of the chair. He's gonna grab the support of the chair. He's gonna lower to one knee.
Y'all want sound effects?
Dramatic. Lower to the other knee. And from there, you're gonna move into a seated position. One side or the other. Oh, boy. You're gonna lay on your back all the way down with your feet away from the chair. And now you can say it. I've fallen and I need to get up. You're gonna roll onto your stomach. And obviously, if you've set this up, your chair is close, but if you're in your home and the chair wasn't close, you can crawl to wherever you need to go. So he's gonna crawl to the chair. Crawl, John.
Some of you may not be able to get in this position because of your back.
I'm sorry.
Even if it's on your side, you can do it.
Keep going. Grab the chair. Is this your best effort?
Trying to make it realistic.
Okay. We're gonna move this. So now that he's kneeling and he has the chair for support, he's gonna bring one foot forward.
Because now I've got I can use my upper body to support myself, to lift it up, just one leg. And then,
Leaning the body weight towards the chair, he's gonna pull the other leg in. That made me nervous.
that was not very
What
artistic on
happens
my part.
if the chair moves as you are trying to climb on it?
I would say to that, you really want a steady support, but you could push that chair to a wall or into a piece of furniture or somewhere that it has stability.
And keep in mind, your body weight is going to be on top of this. So hopefully, I mean, if it's on rollers, no, but like push it towards the wall, push it towards something that's going to stop it from rolling. But like for my case, that's a lot of weight on this chair for me. But if you feel it to start to go, say that it starts to do it.
Until you get to a wall or something that will stabilize the chair.
I can't believe this is going to the video.
Did that answer your question? Okay. We're gonna move this back down onto the floor. Is there anyone in here that knows they can get down and get back up that would like to demonstrate just to break the ice? Great student right here. You can just move it if you like. So we're gonna do the same thing that he did. I'm just gonna move this. If you need it for your knees, if you don't need it, okay. So you're gonna come close to your support. You're gonna get down onto one knee, both knees to seated. Come on down. Yeah, all the way down. She's falling. Watch her get up.
Okay, you want me to do it the way you're doing it?
I would like that, yes. I'm interested in how you would normally do it, but to your side?
Oh, I normally
Yeah.
do it.
Okay. Okay. Yep. There you go. Bring your hands around to the support. You want to come nice and close. One foot forward. The other foot forward. And stand all the way up. Beautiful. I know that a lot of the ladies in my chair yoga class can get down on the ground and get back up because we do it every day. We do it for meditation. Most of us do. She has had an issue where she experienced a blood pressure fluctuation. Yes. Mhm. The way we showed you. Hands on the chair. Are you nervous? Down onto one knee,
Beautiful.
down onto both knees, to seated either way, one side or the other. That's okay. You missed the mat.
To go all the way down?
It's up to you. Yeah, there you go. And roll onto your side. Hello. Meditation's over. You'll turn towards the chair. She's pretty strong. She can get up without the chair, but for demonstration purposes, there you go. Congratulations.
When you're doing this, I want to make sure you do it with a chair. Do not attempt to do this with a walker or a four-wheeled walker.
So you're teaching us how to get down and get back up because you want us to practice that to increase our strength, because you know, if you fall and by accident and you've broken something, probably not going to be able to do that. So the purpose is to be able to practice at home doing it.
That is exactly correct. And obviously, if you fall and you have broken bones and it's much more extreme than just needing to get back up, that's a whole nother scenario.
Believe it or not, there's a lot of people who walk around on a broken hip and don't even know it. But the reason this is so important is if you fall, and it's 1 o'clock in the morning, how long are you gonna lay there before somebody notices you're not where you're supposed to be, or whatever? So, what the purpose of this is to try to empower, okay, wait a minute. It's 1 o'clock, no one's gonna come. You don't wanna lay there for hours. I'm not saying that this is always gonna work, but at least it's a technique that if you can remember that you can try to get to a position where you can get some help, or you're not just laying there on the floor. Okay, so that's kind of why that's one of the important things of practicing it.
See if I'm getting it right.
I was just wondering if you could point out equipment that you have upstairs that could help strengthen if we, okay.
Mhm.
Oh, my.
But see, now he's just showing off.
Are you gonna use the chair, sir? Careful.
And that's pretty much the same technique as this, except with the chair, you're raising your arms up a little bit, and it's a little bit safer. But you did the exact same thing, one leg up at a time.
The young lady over here had a question about the gym. Oh, boy. That's poopy.
What'd you say?
She was curious about the gym, the exact movements that he's talking about, the hip abduction and hip adduction. We have a hip abductor
Yep.
and a hip adductor that you sit
Mhm.
on, and you press out against resistance and you push in against resistance. That is exactly
Yep.
what you need to
That's
strengthen
exactly
your
what you
gait.
need. Mhm.
Hip abduction, hip adduction. And I would add to that, in the balance class, every single balance class, we do hip abduction, hip adduction. We do leg extensions. We strengthen the whole structure and the core to help you build lower body strength and strength through the core. That class meets at 10:30 every day in the gym.
What time, sorry, what time was that?
10:30.
10:30?
Monday through Friday.
Okay, Monday through Friday.
And if we fill the gym up, we can have it in here. If we need more seats, we'll have it in here, because we want to serve the people that are eager to better themselves and strengthen themselves.
Do you know what the best thing that these folks can do to not fall?
Not fall.
That is correct. That's not where I was going with that. But touche, you got me on that one, yeah. Move.
Anyone else want to
Move,
come up?
guys, move. So the balance classes, these exercise classes, that's gonna be the best prevention of falling.
And you have a fabulous resource available
I
to you.
really encourage y'all to utilize. Y'all have such a great spot up there, and so,
What about people that have knee surgeries, each one? You can't get on your knees. How do you recommend they get them?
why can't you get on your knees? I have not had a knee replacement. I've worked with a couple of them, but, yeah, getting on your kneecaps hurt because it's bone. But you're not gonna hurt that titanium that's in there. It does hurt. But again, this is not, I'm not asking you to get on the floor and get up all the time. But if you fall, as opposed to laying there for 2 or 3 hours, this is a tool in your toolbox you can use to at least get up to a chair and or get help, as opposed to lying there for 4 or 5 hours. And it happens all the time.
Did that answer your question?
Yeah, I know how to do it anyway without that.
Okay, so I have a question. If you fall in the bathroom, there's usually just one chair in there called the commode.
Mhm.
Can you use it, or is it better to crawl out into another room where there's a chair?
Does the commode have these? You can put the lid down and try it, but I would probably, it depends on how far away is the other, I think at that point you kind of have to use your best judgment on that. Yeah, I don't have a good answer for you on that, to be quite honest. I think it depends on how, if the one is way, way across the apartment or the cottage, then I would probably try to use the commode.
Have you seen the toilet come unseated from the bottom?
I've never seen it with somebody, but, you know,
There is a chance that they can be loose, the bolts.
It could be.
There's only 4 bolts holding that toilet there. If it is weakened over time and you're not aware of it and you lean against it, the toilet can fall. So,
but
just
you're
something to
pushing,
think
but
about.
generally
If you-
you're pushing down on
And
it,
it's
so,
wobbling,
you know.
don't use it. I mean, use it if you have to use it, but then get maintenance to fix it.
Keep your commodes tight, people, keep your commodes tight.
You know, I go up and down a lot, and I fall a lot, and I have 2 total knees. But, you know, you don't have to have a chair. If you've got the sink there or something enough to steady you, you can work yourself back up. So, I mean, you just absolutely don't need a chair. I've even come back up through a wall, you know.
I think anything that you can use for support. I think the situation with the chair is some people can't get high enough up to.
That's what I was gonna say, the chair is
Or high
generally
enough
lower
up to get
than
leverage against a wall.
than a sink, but
However
however you
can
do
get
it, and it's safe. Hey, I'm okay with that. I would try not to, I'll maybe try to cut down on the falling though.
Street, and you can fall easily on the street with all the breaks in the curbs and the breaks in the concrete and the asphalt. Trust me, I've been there. But trying to get up when you're on the concrete sidewalk or in the grassy area is tough.
Getting up from an uneven surface is definitely is more difficult. Getting up on the grass where it sinks is much more difficult.
no support.
That's a whole different lesson.
It's the same process. Did you see Mr. Cheney get up off the floor without a chair? It's. Yeah. Yeah. Yeah, John, can you get up off the floor and get back up without a chair? Just show us, please.
Yes, I can.
So same thing, he's down on his back.
Does it significantly harder when you don't have that upper
Yes.
butt?
I'm sorry, I can't hear you back there.
Roll over,
He's gonna roll over on his stomach.
into this position.
He's gonna lift himself.
On both my arms, get into this quadruped position,
Can you speak into the microphone?
into this quadruped position. And then I'm gonna bring up one leg, keeping my hands on the ground. Pull my arms in. Get up.
You wanna show where you use your leg for support?
Yeah, you can do that too.
Because that does help if you don't have anything, you can use your own body as leverage. So when you step that foot forward, you're gonna lift your torso up, place both hands. You didn't do it right. I have on inappropriate footwear, just for the record.
Okay, now I get to critique. Now she's just showing off.
How old is she?
When you get that foot forward, you're gonna brace yourself. You want your strong leg forward, but you'll use both hands. With both hands and tucking the knee under, you can lean forward and press up. That way you don't end up in a situation like this, where you think you're trying to get up and the next move is you just tumble over. Right, I'm keeping my head upright, so it's less, in my opinion, can happen this way. I either just don't get up. Right, if I'm not strong enough, I just don't get up, but I don't fall forward. Does that make
And-
sense?
But what if you can't use your knees?
Well, I've had both my hips replaced. So I don't know if it's painful, I understand that, but
Yeah.
being on the ground for long periods of time is more detrimental than the pain that you would feel getting on your knees and getting back up, because there really is no way without getting on your knees to get back up. You know how you can do it without your knees, John?
Unless you're trying to reach up by a grab bar, but man, that takes a lot of upper body strength. And again, there's more than one way to skin a cat here, just, if you have a way that you get up and it works for you and it's safe, again, hey, that's great. But for most people, this is gonna be the best way to do it. And is it gonna be uncomfortable? Probably. But it beats laying there for a couple of hours.
If you have a question, if you raise your hand, I've got people trying to get my attention different ways, so I'm not really sure. And if I see you, I'll try to come over and catch you, but I'm coming, just a second. I'll be right there.
Okay, I've had a few falls, not here thankfully, but they were soft falls. But the shower thing, I get out, step over the shower, hold on, step over, and then I have a chair. I have a chair that's backed up to the sink and with a towel in it, and I sit down, and that's it. One step, boom, you're sitting down, do the rest in the seated position.
I think that's very good, and it kind of goes back to what John said about preparing your environment.
Yeah, I would wait. But if you're there by yourself,
I mean,
you really don't have a choice. Now, if you hit the button, you can sit there and wait. But in the case that no one has been notified, that's really what we're talking about here. Again, I don't want people laying there for hours. I mean, I can tell you horror stories. We had someone here who they got up and they literally got lodged between the commode and the wall and laid there for a lot of hours, to the point they had multiple wounds from pressure. Now, that's kind of a weird thing, and that's not necessarily relevant to us getting up off the floor here, but the point is that
Okay.
the other thing is if you've had a fall and you're laying there for hours and hours, then, you're talking about dehydration, you're talking about all these other things that start to happen. So it's generally not a good idea to lay there for hours and hours and hours. And that's what we're trying to avoid.
I have a question right here.
During COVID, I had a very odd fall, and I'd like to know what you think I should have done, okay? I was in bed, I was feeling very bad, and my husband brought in a trash can and put it by the bed so I wouldn't have to always get up and go. And I got up one time, and of course I'm weak. I fall in the trash can butt first. I yelled for my husband, and I yelled for my husband, and finally he comes in. I do have a duck call that I use sometimes, but I couldn't reach that. Okay, so I call in a call, and he comes in, and he looks at me and goes, "How'd you do that?"
And I'm assuming that he was going to help you. Thank you for sharing. I got one more question.
Maybe some oil or something could have helped with that situation.
It's like Winnie the Pooh.
Don't forget that we have pull cords. We have pull cords in the bathrooms. We have pull cords in almost every room. Know where they are and test them out. Call the front desk and say, "I'm going to be testing my pull cords."
I'm proud of you.
And
That's
that
great,
is,
thank you.
that is we want, we want somebody notified as soon as possible. But if for some reason, or whatever, it's just, again, it's another tool in your toolbox to avoid just laying there.
If anybody wants to come to the gym later or get with me privately, if this is just not conducive for you, We can go into the yoga room, even somewhere more private. It has a padded floor in there, and if you want to practice, I'll be glad to help anybody that's wanting to do that. You can just reach out to me.
What time was that class again?
10:30 every day, balance class. Hip adduction, all that strengthening of the lower body and the core. 30 minutes is the best time of your life.
I really believe that exercising and keeping that strength up is one of the best things you can do to prevent falls.
He's right.
And think about it, examine your area, pre-plan, okay?
And utilize
Thanks,
that
guys, for
checklist.
coming.
It's just to keep it fresh in your mind. Inside your folder, there's a checklist. Take that home in case you forget some of the points, and just go through your house. Make sure that everything is there to reduce your risk to fall.